Good evening, everyone. How are you all? Good. So tonight we are going to start our physical examination course. Now, many of you are here as part of our free session tonight. And I know that most of you are our course students. So it's a mix up of everyone in here. So, and also some of you are only our students for physical examination. So welcome everyone to this beautiful course, which is going to happen for the next 1 month. Now, in my aspect, this 1 month can change your journey to Australian doctor. How it's so? Because if in the exam you pass 3 or 4 physical exam, most likely you're going to pass the exam. If you're not actually totally amateur, then yes, you are going to pass the exam if physical examination are all good. So it's a very, very important thing for you. And as you know, like there are now 2 kind of format for physical exam, face-to-face and online format. So some of you are going to go for your online examination, some of you face-to-face, some of you don't know what mode of exam you're going to appear. In our view, if your exam is already set that you are going for an online exam, maybe in 2-3 months, then just prepare for online exam. Forget about anything else. If your exam is set for face-to-face exam, then only face-to-face, nothing else you should care about. If you don't know what will be your mode of exam, then yes, you have to prepare for both, because no one knows which mode you will get. And eventually online format will not be there. When COVID thing is gone, maybe in next 1 year or so, there will be no online exam most likely. So if you are very beginner, then you have to prepare for both. So in the course, we are going to cover both face-to-face and online physical examination. Now, many of you, like not many, I would say most of you are our 5 months clinical course students. So you guys are already know how we teach you, how our classes happens and everything. Some of you who are new to this course, especially only you will be doing our physical exam course for the next 1 month. For them, just remember one thing, that if you already paid for the course, you are already added to the Facebook. And in the Facebook group, you will get everything that you need. So you're going to get class information, a schedule is already uploaded. So everything is there already. And also you are going to get the course materials, including the recording and the notes in your software. So I guess you already got how to access the software and everything. So we'll discuss about that after the end of this class as well. Let's start the physical examination, and then we can discuss about the course a little bit. So in physical examination, as you understand that this is not in a place where I can show you on a mannequin that how to do the physical exam. But for online exam, you don't need to know that. Same for the face-to-face exam. I will show you in a way that you never even need anything like to be seen on a mannequin. So I will make sure that you don't feel that you are lacking something, and you will understand it how. So we have been taking the classes for a long, long time, for the last 4 or 5 years, and never ever physical examination was a problem. So you will find out like how important it is and how efficient it is for your exam preparation. And I can guarantee you that this physical examination, the 8 classes that you're going to have with me, it will be one of your best classes. So lots of bubbling, let's start the class. So tonight, this is a free session for everyone. So we are going to cover most likely the hematology, the rash physical examination, and the wrist cut physical examination. 2 most important topics, which is which is coming in the exam for the last 2 years back to back. And it's really hard as well because a lot of cages are there. And sometimes if you just memorize only one particular thing, it will never ever work in your exam because there is a lot of cages, and always in physical examination, relevant physical exam is important. You can't get away with just memorizing a particular note and then just vomit in the exam. Never ever that's going to help. Now, those of you who are our previous student, most of you already did this class, but we have made a lot of changes. It's not just that, like just going through the physical examination step now. Now I have written in a way so that you can also get help for your online exam. So tonight I'm going to show you the rash physical examination in both face-to-face and online examination. Okay, and if we get some time, which most likely we will get, we will also do the wrist cut physical exam. So the basics of physical exam. So what are the basic? Any case, like if it's a online face-to-face, nothing matters. Basic is always there. You have to be very gentle with the patient. There is no other way around because you always get some mark in your approach. So everywhere, even it's not only in the physical exam cages, in every cages, approach is a part of your marking. So being gentle, that's must for passing the exam. Second, whatever you do, especially if you are going for a face-to-face exam, take permission for everything. Even though you will take consent initially, you should always take permission before touching the patient. Every time you touch the patient in face-to-face exam, you should always take permission. Say that I'm going to feel your knee joint. I'm going to feel your elbow. I'm going to touch your arm. So whatever you are doing, if you are touching a patient, you should always say that you're going to do that. That's one of the very, very important way to pass the approach part of your exam. And no one likes if you're just touching inadvertently. Next, make sure you explain what you are doing at every step of the way. This is more important for face-to-face exam, that you have to explain to the patient or the role player that whatever you are doing every time. That if you say that, now I'm going to feel your knee joint, do you have any pain in your joint? So you always explain that I'm going to do this, I'm going to do that. So explain everything. In some cases, you will need to assure that there is a chaperone available. Chaperone is another person who will be present during your examination, and that is important for when you are examining a patient's sensitive body part, like you're doing a scrotal exam, you're doing a breast examination. In those cases, you have to make sure that there is a chaperone available. Most of the time, a female nursing staff will be there if you are doing a breast physical exam. If this is a scrotal exam, most likely a male nursing staff will be there with you. Now you can ask me that if I am a female, do I need to ensure a chaperone? Yes, you do, because there is a lot of patients in here who are either bisexual or they are like having attraction to the same sex. So it's very important that even if you're of same sex, you need to make sure there is a chaperone every time you are examining a sensitive body part. Next, you need to wash your hands. There is no other way. This is an era of infection, and examiners are very cautious nowadays that if you're washing your hands or not. Now, obviously, in online exam, you can't show to the examiner that you are washing your hands, but you have to say that, yes, you're going to wash your hands. In face-to-face, you have to show that, yes, I'm washing my hands before starting my physical exam, after finishing my physical exam. So washing hands is must. And especially for if you're going for a face-to-face exam, then running commentary is always important, which means that whatever you are doing, you have to give running commentary to the examiner. So what is running commentary? So let's say you are doing a physical examination of a knee joint, right? So you're saying that I'm going to feel your knee joint right now. Do you have any pain? No, doctor. So then you will be feeling the patient's knee joint with your hand, and you will give running commentary to the examiner, or you can say that there is no tenderness on the patella tendon, tibial tuberosity, medial and lateral joint line. So what you are saying, everything that you are checking, you are giving running commentary to the examiner. And in face-to-face exam, examiner will give you findings each time you are giving this running commentary, which is totally different in online exam. That means examiner does not talk to you. He is not going to give you any finding. And most of the time, the task is different in online exam, which we will come across, don't worry. So what is the difference between online and face-to-face physical exam? Right now, you know a little bit, right? And many of you are already into this AMC clinical exam thing, so you might be knowing everything that I am saying. Now, online physical examination, the type of question is different from face-to-face physical exam. In online physical exam, usually they will give you a scenario, and either a medical student will be there or patient will be there. So the task will always be like that. So let's say a 35-year-old female coming to you with a rash in the lower legs. There is a medical student with you. Explain how you are going to do physical examination to the medical student. So then you have to explain the process or procedure of your physical exam to the medical student. When you are discussing things to medical student, you can use medical jargon. Okay. Next, sometimes there will be no medical student, rather maybe only thing will be patient. So they can say that explain the physical examination to your patient. When you are explaining these things to your patient, you have to explain it in a very simple way without using any medical jargon. Now, that doesn't mean you can't say any medical jargon. You can always say, like you have to say the name of the test, like you are doing Schober test for back pain. But yes, you have to say that, yes, I'm going to do a test called Schober test. Then you explain what is Schober test. So some medical jargon will always come, but as much as possible, you have to explain that jargon. Sometimes task will be explained to examiner. Same like medical student. When you are explaining things to examiner, you can use medical jargon as much as you want. No problem with that. Fourth, sometimes they ask you specify which equipment you are going to use. So equipment means like sometimes if this is a particular task, then you have to say what are the equipment you are using for this examination. And sometimes they also add that discuss physical examination with anatomical landmark. What is anatomical landmark? Everything that you are doing, like if you're doing an epitrochlear lymph node examination, where you are palpating the epitrochlear lymph node, that's your anatomical landmark. Okay, so everything that you are doing, if you're explaining it in detail, that will cover anatomical landmark also. So those are usually the online physical examination task. How about physical examination task in face-to-face? In face-to-face, the question will be same, but the task will be do physical examination or do relevant physical examination on this patient, give your diagnosis and differential diagnosis. When it is face-to-face, you have to ensure that you give running commentary after every physical examination. So if you're doing inspection, what you are finding on inspection, you have to describe it to the examiner. If you're doing a palpation, you have to say what you are palpating and what is your finding. Okay, sometimes you might be palpating on a knee joint and knee joint is not red or tender when you are palpating. But when you say that the right knee joint is non-tender and there is no raised temperature, examiner can say to you Yes, you can feel a red raised knee joint. That means that obviously they can't give you a patient who is actually sick. So that's why you might not, sometimes you will be doing examination on a normal person and you will give your running commentary, but examiner will give you the finding when you are doing that. Only the things you will say, if you say it correctly, then only examiner will give you the finding. If you don't say that particular word, examiner will not give you the finding. Okay. So that's the basic difference between online and face-to-face exam. Now moving into the deeper part. Any physical examination, we always follow a basic approach, which is called wipe approach. Wash your hands, introduce yourself with the patient, take permission of what physical examination you are going to do, and make a proper exposure of the examining part. So that's your basic part of your physical exam. You have to always do that. Now, all of you know this picture, right? This is how the online exam is happening right now. So this is you who is having a false smile in front, but you are dying inside, right? So that's always the important thing. Your smile will be there, but you can die inside. That's fine. But you should not show it. You have to be confident. Okay, so smile if it is appropriate. And that's your role player who will be there in the video. You can see the role player. Invigilator will be there who will conduct your online exam. And then there will be an examiner who you will never ever be able to see, and they will not talk to you as well. Okay. Any questions so far? Good. Moving on to rash physical examination. It is. Dr. Ivrim, good question. In face-to-face exam, do they ask also explain to the medical student? Yes, they can ask you. Especially nowadays, the exam that you can say the PLAB exam or the MRCP exam, they have done that. Like they are not allowing the students to touch their patient. So you are going as a face-to-face candidate, but you are not touching the patient or role player. You're just explaining what you're going to do. That can also happen, especially for these COVID years. Most of the time you're doing this. Okay, so yes, in face-to-face, sometimes they can ask you to explain it to the medical student, and you don't need to touch the patient at that time. Examiner does not talk to the candidate in online exam, but examiner talk to you all the time in face-to-face exam. Now, if you have to ask hemodynamic stability, you can't ask it in online examination. You can just say that you want to check it. Okay, so but you can't ask it because they are not going to answer it for you. Again, if you have to ask about investigation finding, you just need to say that, dear examiner, I would like to have this physical, this investigation, like I need to have my X-ray. Then examiner or the invigilator will show it to you. They will not talk to you, but they are listening to you. All right, now let's move on to rash physical examination. In rash physical examination, there is a lot of topics. Now, tonight we are not finishing all the rash cases. I will just show you the basic thing so that you understand the online and face-to-face approach first. First class is about understanding it, because then from the next class, you can easily understand what I am talking about. Sorry, I've got a question. So, Dr. Gayani, if in online exam from whom we shout clear our doubts. Now, everything will be written in your stem very, very clearly. There should not be any doubt. Okay, so everything, your task will be written in so much detail that it should not make you confused in the exam. And you can't ask anything from examiner, so do not do that. You are just wasting your time. An invigilator is not a doctor. Invigilator is not a part of your exam. They are there just to conduct the exam. So they are not going to answer the questions if you are having any doubt about. You have to do it just as it is written in your stem. Yes, Dr. Wafi, it can come. If it can come in both. Anatomical landmark equipment can come in face-to-face as well. Okay, guys, moving on to rash physical examination. First, we are going to do the ITP or Hsp rash examination. You are a GP, a 28 years old patient coming with lower leg rash for the last 3 days. He had a history of sore throat about a week ago. Now the throat looks fine. A medical student is with you. Your task is to explain the rash to the medical student, explain what other examination you will do to the student, give diagnosis and differential diagnosis to the student. So always read the task properly. It is very, very important. Even though most of the time in online exam, the task will be in front of you, always on the screen, but in face-to-face, it will not be like this. You have to remember your task. And in online or face-to-face, you can write during the 8-minute time. So if you want to write some finding, you have to write it in the 8-minute time inside, not in the 2-minute outside reading time. Remember one thing, if you write it in the 2-minute outside reading time, you are going to fail the exam. Even though if you pass all the cases, 14 cases if you pass, your exam will come as a withhold. Okay, so please never ever do that. So a 28-year-old patient coming to you with a lower leg rash for the last 3 days. He had a history of sore throat about a week ago. So what you have to gain from this stem, that a patient having a lower leg rash, you can always see it in the picture. Okay, when in the 2-minute outside, look at the rash very quickly and then look at the question. So you can see that there is lower leg rash looking like a kind of purpuric rash, and you can see a sore throat history about a week ago. Having a sore throat history is very important because viral infection, right? Viral upper respiratory tract infection. What are the rashes, which is purpuric kind of rash, which comes after a viral upper respiratory tract infection? You already know your diagnosis just by reading these 2 lines. Most of the time, it's either ITP or HSP, right? So that's usually the cause, but you should never ever come to a diagnosis just immediately. We will do the examination, and if anything comes up, we will understand the diagnosis at that time. But just by reading the question, we know already that it's either ITP or HSP. So your task is explain the rash to the medical student. So task is very important because this 1 to 3, there is a meaning of it. Everything will be marked, and then you will be getting a global score. So your mark will be like this: approach. If you get 4, so your mark is from 0 to 7, right? So if you get 4, then you pass this task. Then let's say explanation of rash there is another marking 4. Explanation of your physical examination, that's 4. Diagnosis and DD, 0. Now, then you get a global score. Now, even after this, they can make you 3. Or if they like your approach, they can make you 4. So the global score will define if you pass or fail this case. So if you, sometimes you can run out of time and you have forgot or you haven't got the time to say the diagnosis and DD. Still, you can pass the exam if everything was really good and examiner liked you. Okay, so your approach should be very, very good. That's the reason why I am saying all of it. Okay, now let's start with the online explanation first. Normally, I used to do the face-to-face always first, but because this is the online era, let's do the online exam first, and then I'm going to show you how you're going to do this same case as a face-to-face format. All right. So in online exam, it is easier. Why? Because you just need to remember that what are the physical exam you are going to do. If you have a format in your head, it's very easy to deliver it in the exam. Okay. But doing it on a patient in a face-to-face, it's way harder than just explaining things. Now, for some of you, if you are not very fluent, it might be difficult. So always I say that if you are fluent, you choose online exam because then it becomes very easy for you to pass that exam. If you are not very fluent, but you know the things pretty well, you are not very nervous kind of person, you can do examination in front of the examiner, then yes, you go for face-to-face because then it will become easier for you because you might not be fluent, which is not very important for you in here. If you show to the examiner that you are doing it correctly and you are just giving some good running commentary, you can pass that exam. So it always depends that how well you are in your fluency, how well you can explain things to others. All right. Now let's move on. So now I'm going to show you how this case we are going to do it in an online exam. So our task is to explain this rash to the medical student, then explain what other physical exam we are going to do to this patient, and that also to the medical student we are explaining. And lastly, diagnosis and DD. So always your starting will be always similar, and you can memorize only one particular format and use it in all online examination. So say in that way, hi John, I am Arshan, one of the GP in this clinic. It is very nice to meet you. So I understand that you are in a medical institute. So which year you are in currently? So they say 4th year. Oh, that's great. It must be so exciting for you. Well, I'm very glad to show you one of my patients today. So John, we have got a 28 years old patient who presented with a bilateral lower leg rash for the last 3 days. Although his throat looks fine today, he had a sore throat about a week ago. Today, I'm going to discuss with you on how to examine such a patient. If you do not understand at any point, please do not hesitate to ask me again. So the starting should be really nice. Okay. So you always make an introduction of the patient and also introduce yourself with the medical student. So this is your introduction, and always explain that what is this case all about and what we should think about this case before proceeding to the physical exam. That's a very good idea. You think yourself as a mentor or as a teacher. So if you can think yourself as a teacher who is explaining things to his student, then it becomes easier for you in the exam. So if you're explaining things to a med student, you think yourself as a teacher, okay? And then you will find out it's exactly what they want from you. So then you say, first, we need to think what could be the underlying causes of such a rash zone. In general, there could be numerous causes of rash, but in short, we can divide it into rash due to infection, which could be viral, bacterial, fungal, could be inflammation like Enosholin purpura or any connective tissue disorders, could be malignancy like leukemia, lymphoma, could be any hematological causes like ITP, could be drug-induced or even allergic causes. Keeping all these possible causes in mind, we are going to start our physical examination. So see that in face-to-face exam, we would not do these things. But in online exam, we are actually making a ground that what exactly we should look for in this particular patient. We are not just going to start physical exam without saying anything. We should always make a background things first, and on the basis of that background, we should explain things. Now the medical student will understand why you are checking epitrochlear lymph node in this patient. Now the medical student will understand why you are doing a fundoscopy in this patient. If you don't say what causes you are looking for, it becomes very hard for a student to understand the reason. So you have to say those things first. Then you say, but before we start, we need to wash our hands, introduce ourselves with the patient, take a proper consent about the procedure of the exam, and request for an adequate exposure of the examining part. So that's wipe thing, right? We don't say wipe we don't say wipe, but we explain what wipe means. After that, say that once the patient has given the consent, then we are going to start first with the general appearance to check if he looks comfortable or in distress. So any physical exam, we first start with the general appearance first. In general appearance, it means that you are actually looking to the patient that he's comfortable or in distress. You're looking for any obvious sign of abnormality. After that, we will check his vitals, including blood pressure, pulse rate, respiratory rate, temperature, and oxygen saturation. In this case, checking the temperature is very important because that will help us to find out if this patient might have any infection going on. See that time to time, you always give some reasoning. Like specific reasoning helps a student to understand it very well. So like normally I would say that we will check his vitals and we'll be done with that. But now we have added in here that in this case, which is very important, checking the temperature is very important because that can be found positive if it is an infectious rash. So time to time, add those things, which will give a very good weight on your examination. An examiner will love it. After that, we will start with a focused examination of his rash, which includes inspection and palpation. On inspection, as you can see, so that's your first task that you are doing now, explanation of the rash to the medical student. So on inspection, as you can see, he has got rash in his both legs. Looks like pinpoint red spot, which we call petechiae. No discharge, no scales or scratch marks. And then after taking consent from the patient, see that we have written in here that always before touching a patient, we should always take consent. So say that then after taking consent from the patient, we will feel the rash for any raised temperature, any tenderness, if it is palpable or not. And then with a glass slide, we will press over the rash to see if it is blanchable or not. Now, blanchability is very important part of rash physical exam because if it is non-blanchable, we will think about the possibility of some serious condition, including meningococcal meningitis, ITP, leukemia, or HSP. Okay, so that's your examination of the rash. Examination of the rash include inspection. On inspection, you are mainly looking for the site of the rash, which is in here, bilateral lower legs. Then what is the morphology and characteristic of the rash? In here, looks like pinpoint red spot known as petechiae. Then you are looking for what is the distribution of the rash. Is it only in the lower leg or the whole body? Then you will be looking for if there is any discharge, any scales, any scratch marks. Okay, that's your inspection. After inspection, then you will do palpation of the rash. Palpation is temperature, tenderness, blanchability. So in temperature, you are looking for any raised temperature, which can be positive if it's underlying infection or inflammation. Then tenderness. And then if it is palpable or not. Rash palpable is very commonly found in Hsp. And then with a glass slide, or sometimes even with your thumb, you can press over the rash to see if it is blanchable or not. So that's your rash examination. Always, in every rash examination, you will follow the same approach: inspection, palpation. Yes, at least once, Jody, say what is Hsp, Henosolin purpura, and then you can just use the Hsp all the time. You don't need to say full term every time, because it will just waste your time. Yes, Dr. Javed, you can wear gloves at that time. You can always say that we will also wear gloves during our rash examination. Now, you have explained the rash. Then say that once we have examined the rash, then we will do a full systemic examination from head to toe, looking for any other causes of the rash. So then your second task starts from here. You will say, first we will start with hands, looking for any spoon-shaped nails known as koilonychia, any palmar pallor, both of which can be found in iron deficiency anemia. Now, why anemia is important? Because if it is a hematological condition, then anemia can be positive. Maybe not iron deficiency, but at least palmar pallor will be important to rule out anemia, which can be found in hematological malignancies like leukemia, lymphoma. So always give your reason, time to time, give your reason so that they understand why we are looking for this. Now, good question. I don't know what's your name coming as a Galaxy S8, but good question. How we comment on blanchable or non-blanchable in online exam? You can't. Your task is not to comment on or giving positive finding. Your task is to explain things in online exam. You just say that what you are going to do. Okay, in face-to-face, you will need to show it to the examiner, but not in online exam. So you don't need to comment on your finding. You just explain what you are looking for. So in the first, what we are going to start with, we will say, first we will start with hands, looking for any spoon-shaped nails known as koilonychia and palmar pallor, both of which can be found in iron deficiency anemia. Then we will examine the forearm, looking for any bleeding spots, bruising, petechiae purpura, any scratch marks or injection marks. Now, getting this bleeding spot, petechiae purpura, indicates possible chance of ITP or platelet deficiency. It can be also found in some other hematological malignancies like leukemia, lymphoma. Same scratch marks can be found in lymphoma, and injection marks can be found in IV drug abusers. Okay, so you have done your hand examination. In the hand, only thing that we are looking for in this particular patient is koilonychia and palmar pallor. And in the forearm, you're looking for any sign of rash here, like bleeding, bruising, petechiae purpura, and also a scratch mark or injection mark. After that, you move forward. Epitrochlear lymph node. So then say that then we'll palpate the epitrochlear lymph node on the medial side of the both elbows, just above the medial epicondyle of the humerus. So what you're doing in here, anatomical landmark. See that how we explain things in a very simple way, but without explaining too much. That's also important, because if you're explaining a lot, it will not sound good, and the medical student will have a headache by listening to you, which you don't want, at least not in the exam. So say that we are going to palpate the epitrochlear lymph node on the medial side of the elbows, just above the medial epicondyle of the humerus. And this can be palpable in lymphoma patient. So reasoning, always important. You give your reason every time. In online exam, always. Even it's to the examiner, medical student, or even to a patient, you give reason why you are looking for it. After that, so we have done elbow. After elbow, what's your next part? Face. So after that, we will examine his face. First, starting with the eye, looking for pallor by pulling down the lower eyelid. Pallor, why it's important? To look for anemia, can be found in hematological malignancies. Now remember, if you have told these things already, don't say it again, because you already explained that pallor can be found in hematological malignancies. Done. Icterus or jaundice by lifting the upper eyelid. Conjunctival hemorrhage or injection to rule out any increased bleeding tendencies. Also, we will do fundoscopy to rule out any retinal hemorrhage. We will quickly check the ear with the otoscope for any bleeding or discharge, nose with a nasal speculum for any epistaxis. So in the face, mainly we are looking for eye, ear, nose, and mouth. Because in online exam, you are explaining a lot of things. Try to explain one by one, giving reasons, and don't go in too much detail. But always, if there is an important anatomical landmark, you should always explain that. Like epitrochlear lymph node, it's a very important landmark. You have to say it correctly. And explain that some of the physical exam, like how we check pallor by pulling down the lower eyelid, how we check icterus, lifting the upper eyelid. Okay, and then conjunctival hemorrhage or injection is important for bleeding tendencies, which can be found in any of the hematological malignancies again. Also, we will do fundoscopy to rule out any retinal hemorrhage, same cause. We will quickly check the ear with the otoscope for any bleeding or discharge, nose with a nasal speculum for any epistaxis. What we are doing in here, we are also saying the name of the instrument. There are many times where there is a task already written that explain what instruments you are going to use in this exam. So you have to at least say fundoscope, otoscope, nasal speculum. So these are your specific instrument in here. After that, in the mouth, we will check for gum bleeding to rule out ITP or leukemia, gum hypertrophy, which can be found in leukemia, tonsillar enlargement, exudate, pharyngeal erythema or palatal petechiae. All of these can be found in infectious mononucleosis, glossitis for iron deficiency, strawberry tongue, dry cracked lips for scarlet fever. Because this patient had a sore throat and then having a rash. Scarlet fever can also come as the same way, right? Patient can have a sore throat and can have a sunburned appearance, rash in their body. So we are also saying that in here. So in the mouth, these are your important things. Now, if you can say things in this way, you already understand that there will be no examiner in the world who will fail you. There is no way. So you have to explain things in a way so that they understand that everything that you are talking is relevant. You are not just explaining things by memorizing something. You know what you're looking for, which is very important actually. So your mouth examination is done. Then you move on to the neck. So face done. In the face, eye, ear, nose, and mouth. In the neck, it's so important not to miss neck stiffness if a patient having rash. So then we will check for neck stiffness to rule out meningitis. Now you might be asking that, do I need to do Karnik sign, Brzezinski sign? No need. Just do the neck stiffness, that's fine. Then palpate the cervical and axillary lymph node. For hematological exam, lymph node examination is must, and you have to discuss it in detail. So in cervical, to check the cervical lymph node, we will go behind the patient and start palpating under the chin for submental lymph node, under the mandible for submandibular lymph node, then angle of the mandible for jugulodigastric lymph node, pre and post auricular lymph node, which means in like front and back of the ear, anterior and posterior border of the sternocleidomastoid muscle for anterior and posterior cervical lymph node, occipital protuberance for occipital lymph node, and lastly supraclavicular fossa for supraclavicular lymph node. Now, I know that it is really hard to remember all of it, but you just close your eye and you think the lymph node of the neck, and you don't need to memorize this. You know already all of it. So look at this picture, you will understand what I am talking about. So that's your submental lymph node. Then submandibular lymph node under the mandible. Then at the angle of the jaw, that's your jugulodigastric lymph node. In front of the ear, pre-auricular lymph node. Behind the ear, post-auricular lymph node. Anterior and posterior portion of the sternocleidomastoid muscle for anterior and posterior cervical lymph node. Occipital protuberance for occipital lymph node. And then ask the patient to shrug the shoulder and you put your hand on the supraclavicular fossa to check the supraclavicular lymph node. So that's your cervical lymph node. It does not take too much time if you say in this way. Otherwise, it can even take 1 or 2 minutes just to explain how to check cervical lymph node. Then to check the axillary lymph node, we will palpate behind the lateral edge of the pectoralis major muscle for anterior lymph node. So if you look at here, this is your axilla, this part. Okay, that's the anterior portion of your axilla. That's the posterior portion of your axilla. And obviously, that's your pectoralis major muscle, your chest muscle in the front. So you're checking the lateral edge. So if this is the pectoralis major muscle, the lateral edge is here, right? So you're checking the lateral edge of the pectoralis major muscle for anterior lymph node and the lateral edge of the latissimus dorsi muscle. Now your latissimus dorsi muscle is your back muscle, back of the chest. So that's your posterior group of lymph node. Apex of the axilla for central or medial group of lymph node. So apex is here. Inner aspect of the arm. So this is your inner aspect of the arm, which is for lateral lymph node. And then lastly, deep into the apex of the axilla for apical lymph node. So that's anterior, posterior, lateral, apical, apex of the axilla for central, not apical, central, and then apical. Okay, so again, anterior, posterior, lateral, central, and apical. You have to memorize in this way so that you can explain it properly. It is very easy if you just think about it, closing your eyes. Just think that where are the lymph nodes. And then again, you don't need to memorize these things. You will obviously, you can always remember these things pretty easily if you know where exactly you are looking for. So this is an important part of anatomical landmark in hematological exam. After you have done this part, cervical lymph node, axillary lymph node. Then you go to the patient's chest. So you ask the patient to lie down and you press over the sternum with your thumb for any bony tenderness. And bony tenderness can be found in leukemia patient. Okay. After that, you will do abdominal examination. So abdominal examination. Now, one of the important things to understand, hematological examination is a combination of a lot of systemic examination. So you will be doing abdominal examination separately. Then you will understand much easier that what is abdominal exam. But tonight, I'm just going to show you how we explain things to a medical student and how we do a face-to-face exam using the same question. So in abdominal exam, on inspection, we will look for any visible scratch mark, any mass, any distension, or any bruising. Then we will do a quick superficial and deep palpation for any palpable mass or tenderness. More importantly, we will palpate the liver in the right costal margin and then the spleen from the right iliac fossa towards the left costal margin, as these two can be enlarged in leukemia, lymphoma, and infectious mononucleosis. Very important that you say that you want to check liver and spleen enlargement. Now remember, you don't have time to explain how to do a liver examination appropriately. If you just say that you want to palpate the liver in the right costal margin and the spleen from the right iliac fossa towards the left upper quadrant, you are good. Okay, so you have to also understand how to minimize your examination to finish it in time. You can't explain everything. If you want to do that, you will fail the exam. An examiner knows that you never ever a person can do whole abdominal exam, including all other examination in 8-minute time. It's not possible. So as long as you are touching the point appropriately, they are fine. Then with the consent of the patient and presence of a chaperone, we will check the genitalia for any rash, ulcer, or discharge to rule out possible sexually transmitted illness. Also do a par-rectal exam for any rectal bleeding. Now, for a rash in the lower limb, it's not very important that it is STI, but that's a part of hematological exam we do. Now, for this exam, if you don't say that you want to do this genitalia exam, that's fine. Doesn't matter. It's not very relevant. But par-rectal examination is important to rule out rectal bleeding. After you have done that, then after that, we will palpate below the inguinal ligament for horizontal group of inguinal lymph node and 3 centimeter lateral to the pubic tubercle for the vertical group of inguinal lymph node. That means you are checking the inguinal lymph node now. Inguinal lymph node can be enlarged in lymphoma patient, or if there is a lower limb infection or skin cancer. So very important that we check the inguinal lymph node and popliteal lymph node. So inguinal lymph node anatomical landmark is important. Inguinal lymph node, if you think in this way, there is a horizontal group of lymph node just below the inguinal ligament. And then there is a vertical group of lymph node, which is 3 centimeter lateral to the pubic tubercle. So you just need to say that now for inguinal lymph node enlargement, there are 2 groups of inguinal lymph node, horizontal and vertical. For horizontal, we will palpate just below the inguinal lymph node, inguinal ligament. And for vertical, we will palpate 3 centimeter lateral to the pubic tubercle. We will also palpate in the popliteal fossa behind the knee joint for any enlargement of this lymph node. These lymph nodes can be enlarged in lymphoma, lower limb infection, or skin cancer. And lastly, we will check the leg for any other rash or scratch mark. We will quickly check the joint for any swelling, redness, or tenderness. which can be found in HSP or other hematological malignancies. Okay, then we will finish the exam, we will thank the patient, and we will explain to the patient our finding. We will also wash our hand at the end and make sure we will give the patient permission to redress himself. So always give a finishing like this. And after that, your task is to explain the diagnosis and DD to the student. So you can say that given the history of sore throat about a week ago and the picture of the rash, which is kind of purpuric rash in the lower limb, the most likely reason of the rash could be either ITP or HSP. Then what else it could be? It could be leukemia, lymphoma, meningitis, drug-induced rash, viral rash, allergic rash, insect bite, etc. All right, so that's how you do your online exam. You just explain things properly. Any question, guys? All good. Now that's your online examination, physical exam. You have to understand these things properly and use this same approach every time you are doing an explanation to a medical student. All right. Now let's move on to face-to-face physical examination, how we are going to do it in a face-to-face case. Now that you know it, it will become very easy for you. Good question, Dr. Sneha. If you get some time, yes, just say that what are the differential diagnosis in case initially examiner might forget to mark you at that time. But yes, if you have some time, then say the differential diagnosis at the end as well. But if you don't have time and you have done it initially, most likely you will get marking for that part. Now, in face-to-face examination, the same case, guys, same thing, the way of doing things will be different. So giving you a visual picture that how it will be. In face-to-face exam, same like other cases, there will be a room, and in that room, an examiner will be there who will be talking to you, and then there will be a role player. Some of the role player will be sitting on a chair, some of the role player will be lying on a couch. Then you enter into the room after 2-minute reading time. The examiner is going to say, hello, what's your name? Can I have a look at your card? They're going to introduce yourself with the role player. So then you go to the role player and your task will be do physical examination on this patient, give running commentary throughout the examination, and then give your diagnosis and differential to the patient. Now, the good thing in here is that you can use medical jargon when you are giving running commentary to the examiner. You can always say initially that throughout my exam, I'm going to use some medical jargon. Please excuse me for that. So in case of face-to-face format, as I say, that you have to give running commentary to the examiner. How, like, let me just say that how we would do it. Now, always remember in this case, when you are doing any physical exam in face-to-face format, you have to actually touch the patient. Okay, so you touch the patient, you you say what you're going to do. Everything will be just like a formal physical examination, not like just explaining. So you will say that, hi, John, this is Dr. Arshan, one of the doctor here. It's very nice to meet you. How are you doing today? I got to know from the notes that you are having rash in your lower leg. I'm very sorry to hear that, but please don't worry. Now that you are here, I'm going to find out what causing this rash. So today I'm going to do a physical examination of your lower leg, including the whole other parts of your body from head to toe, looking for any causes of this rash. Please don't worry, I will be very gentle throughout the exam. Is that all right with you if we start our physical exam? Yes, doctor, that's fine. And for the purpose of the exam, I will need a full exposure of your body. So if you can please remove your shirt and the pant, you can keep on your undergarments, but please remove the other parts so that we can start our physical exam. I'm going to wash my hands. I'll give you some time to expose yourself, and then we will start the exam. So first you introduce yourself, explain what physical exam you are going to do, take permission for that, make sure patient have a adequate exposure, go back to the basin for washing your hand, and then wash your hand and come back to the patient, say that, are you ready, John? Yes, doctor. So then you say that, John, I'm going to start my examination now. First, I will start looking at you. So examiner, I can't see any obvious sign of distress, irritability, or any drowsiness in my patient. Dear examiner, I would like to check the vitals, especially blood pressure, pulse rate, respiratory rate, temperature, and oxygen saturation. And also, I would like to check for any sign of dehydration. So most of the time, examiner will give you this finding at that time. John, now I'm going to start first with your rash examination. So if John is lying on the bed, most likely they will be lying on, if the rash is in the lower limb. John, I'm going to first examining your rash on your lower limb. So what you will do when you inspect the rash, you always inspect from bedside and also from the foot end. So from the side of the patient and also the foot end of the patient. And when you are inspecting, you give running commentary, say that, now most likely there will be a picture given. So you can say that I can see from the picture that there is a purpuric rash in the lower leg from the foot up to the thigh. I can't see any obvious discharge, scratch mark, or any scale. John, I'm going to feel your rash now. Do you have any pain in these legs? No, doctor. So then with the dorsum of your hand, you are going to compare the temperature of the both lower leg. Now tonight, I'm not going to show you how to do these things because checking temperature, tenderness, this will come a lot of time in the physical examination process. So we'll do that at that time. So we check our temperature, usually using the dorsum of our hand, and we compare the both legs to see if there is any raised temperature. Then you will check, then you will palpate over the rash to check for any tenderness. You will also comment that if the rash is palpable or not. And then you will press on the rash to check if it is blanchable or not. Okay, so that's your palpation. In the palpation, you use your dorsum of the hand and you palpate the both lower leg for any raised temperature. Check the tenderness, if it is palpable or not, and if it is blanchable or not. And throughout your exam, you give running commentary to the examiner. Say that when you're checking temperature, just after that, you say there is no raised temperature in the lower leg. There is no tenderness anywhere. The rash is not palpable and it is not blanchable. Okay. After your rash examination is done, then you come to the hand. You will say, John, now I'm going to examine your hand. Can you please put out your hand in front of you on this pillow? Most of the time in hand examination, a pillow will be there. So you can say, can you please put out your hand in front? So then you will say that I'm going to check your hand looking for some signs. So on examination, there is no koilonychia, no leukonychia, no palmar pallor or erythema. You are not saying it to the patient, you're saying it to the examiner. Then you will move up. On the forearm, there is no bleeding spot, no bruising, no petechiae purpura, no scratch mark or injection mark. If any findings is positive, examiner will give it to you. And then, John, I'm going to feel one of the lymph node in your elbow. Is that okay with you? Yes, doctor. Then you will hold the patient one hand by your left hand. So if you're palpating the left arm, then hold the patient hand by your left hand and using your right thumb, palpate over the medial epicondyle. Okay, and that's how you palpate the epitropial lymph node. So you don't need to explain this. You will just say that, John, now I'm going to palpate one of the lymph node in your elbow joint. Is that okay with you? Yes, doctor. Then you just check or you just palpate the epitropial lymph node, and the examiner will actually sometimes even come close to see if you're doing it correctly. After the elbow joint, then you will move to the face. In the face, what you will be checking for? Eye, ear, nose, and mouth. So same thing. So in the eye, you will pull down the lower eyelid, checking for any pallor, lift up the eyelid, lift up the upper eyelid, checking for any icterus. You will also do an inspection of the eye for any conjunctival hemorrhage or conjunctival injection. Then you will say that, dear examiner, I would also like to use a fundoscope checking for any possible retinal hemorrhage. Most of the time, there will be no fundoscope given in here. Examiner will say it's normal or it's not available. Then I would like to do your ear examination. I will first check for any bleeding or discharge. So you can say, I can't see any obvious bleeding or discharge coming out of the ear. Examiner, I would like to use an otoscope looking into the ear for any tympanic membrane redness or any bleeding or discharge inside the ear. Examiner will say it's normal or not available. Then using a torchlight or using a nasal speculum, I would like to check inside the nose for any epistaxis. So you will just show to the examiner that you are checking the nose, inside of the nose for any epistaxis. Then you will ask the patient, can you please open your mouth? There is no gum bleeding or hypertrophy. I'm going to press down onto your tongue using a tongue depressor, looking for any tonsillar enlargement. So in this case, you have to use a tongue depressor. That's one of the instruments. So first, ask the patient to open the mouth. Using a torchlight, you look inside the mouth for any gum bleeding or hypertrophy. You can also look for any glossitis, cheilosis, any strawberry tongue, any dry cracked lips. After that, you will say, now I'm going to lower down your tongue using this tongue depressor. Is that okay with you? Then you will be using that tongue depressor, which you will be given in your exam table, and then lower down the tongue and say that there is no tonsillar enlargement, exudate, or pharyngeal erythema. So that's your face exam. Then you have to do the neck and axilla examination. So in the neck, you will check for any neck stiffness. You will check the cervical and axillary lymph node accordingly. We will show you in the class how to do this cervical lymph node and axillary lymph node examination, not today. Then you will press over the sternum And always before pressing over the sternum, say that I'm going to press on your chest bone using my thumb. Do you have any pain over there? No, doctor. So then you press over the sternum and if the patient and look at the patient face, if it is tender or not. If not tender, then give running commentary to the examiner that there is no sternal tenderness. Then you move to the abdomen. Say that, John, I'm going to examine your abdomen now. On inspection, I can't see any scratch mark, no bruising, no distension, no visible mass or visible veins. Now I'm going to feel your tummy. Do you have any pain in your tummy, John? No, doctor. Then you will do a superficial palpation, deep palpation, comment that if you can feel any palpable mass, is there any tenderness anywhere? And very quickly, you will check for hepatomegaly and splenomegaly. Now, again, as I said, that we will discuss all of it, how to examine these things in our abdominal examination. We can't show everything in one session, so we will do it during this particular exam. And then we will do an auscultation for any audible bowel sound. Then say that, John, if you give me the consent and with the presence of a chaperone, I would like to insert my finger into your back passage to check for any bleeding inside. Okay. Normally, in this case, what you can say, especially in face-to-face exam, you can say to the examiner that, examiner, with the consent of my patient and presence of a chaperone, I would also do a parectal examination for any parectal bleeding and also inguinal lymph node examination. And then you go to the leg, say that, John, I'm checking your leg now. I can't see any bruising, any purpura petechiae, any scratch mark. I'm going to feel one of the lymph node, just back of your knee joint. Is that all right with you? Then you check the popliteal lymph node for any enlargement. Then check the knee joint for any swelling or any tenderness to rule out HSP. That's how you finish your face-to-face exam. That means the bottom line of face-to-face exam is that you do it on a patient and you give running commentary to the examiner, and examiner gives you the finding. I know that it's not very obvious to you, this part. When I will show you how to do this, then you will understand much better way. Okay. And in this case, you can give your diagnosis. Now it depends what was the diagnosis. This case was the antibiotic induced rash case. So you can give your diagnosis like that. Okay. Any questions so far? Yes, Dr. Nigley, yes, you have to say it. That's the basic thing of physical exam. Even though you take permission from the patient initially, every time you are touching a patient, you should always say that you are going to touch the patient. Okay, and ask that, is that okay with her? Yes, Dr. Sadia, yes, if it is a chest pain case, yes, you should always do a hemodynamic stability at beginning, depending on case by case. Acute cases always, we make sure patient is vitally stable. Yes, normally, Dr. Salma, if the rash is not present on the patient, you just say to the examiner that, examiner, I would like to palpate the rash for any raised temperature, any tenderness, is it palpable or not? And I would also press over the rash using a glass slide to know if it is blanchable or not. And then examiner will give you the finding. Yes, this file will be available. Dr. Naveen, Good question. We always start with describing the rash. We already have done it in all of these cases. We have first started with describing the rash, and then we started from the hand and go down. Now, Dr. Anam, the important thing to understand for online exam is that you can't ask hemodynamical stability from anyone in online exam. You just say that you are going to check the vitals. If you remember, the first thing that we have done, going back, this was an online case. See that what we said in here, we will check his vitals, including blood pressure, pulse rate, respiratory rate. So we are just saying, we are not actually asking it to anywhere. Now, I will show you just another thing. Now, rash physical examination is fast. There is a lot of rash physical exam which comes in exam. And I have all those things included in here. But tonight we are not discussing all of those. We'll discuss it in our class as well. So another case, the task is a little different, can be confusing sometimes. So 5 years old child had sore throat, got antibiotics, amoxicillin, now started having rash. Father is very worried and came here to talk to you. You need to do a physical examination. Now, the task 1 is tell the patient's father what step you are going to do. Always look that they're asking the step. You don't need to explain whole physical examination to the patient's father. A lot of candidates do that. I would say it's not necessary because your next task is to explain what finding you are looking for to the examiner. So you will explain your whole physical examination to the examiner, not to the father. And then third task is diagnosis with reason. Obviously, even by looking at the case, you know that if someone had a sore throat, then got an antibiotic, which is amoxicillin, now having a rash, most likely it is infectious mononucleosis. How we are going to do this particular case? So your explanation will be like this. So, hi, David. I am Arshan, one of the GP in this clinic. It is very nice to meet you. I got to know from the notes that Sam has got a rash after taking amoxicillin for sore throat. So always, it's one of the important things, always call the patient by their name and also call their son or daughter by their name. It is always a very good idea. And that way, the examiner feels that you actually know what you're doing. This is exactly what you should do in a real life scenario. So I got to know from the notes that Sam has got a rash after taking amoxicillin for sore throat. I'm very sorry to hear that. You must be very stressed about it. But please don't worry. I'm going to examine him from head to toe to find out the cause and then manage accordingly. Is that okay with you? So you're taking permission here. Then say, first, I will wash my hands and ensure a proper exposure of the examining part as we proceed. So see that what you are doing, you also explain the wipe approach to the patient's father. Then say, now very quickly, you will say the steps of your physical examination, not the whole physical exam, just the steps. So what are the steps? We will check his height, weight, and growth chart, check his vitals, including his blood pressure, pulse rate, breathing rate, temperature, and oxygen content in his blood. And also, we will check for any sign of dehydration. Please don't worry, I will be very gentle throughout the exam. Then we will examine his rash thoroughly to check its characteristic, distribution, and extent. We will check his hand for any paleness of the palm that can be found in anemia. We will check his forearm for any sign of bleeding, any other rash. We will check all the lymph node of his body, including the nodes in his elbow, armpit, neck, and groin. We will check his eye for any pallor or any yellowish discoloration or also sign of dehydration. We will check his ear, nose, mouth to rule out any sign of bleeding, any rash, or any sign of infection. We will also use a special instrument called ophthalmoscope to rule out any bleeding in the back of his retina or eye. We will check for any neck stiffness to rule out any infection of his brain and its covering. We will check the tenderness on his chest bone, his tummy to rule out enlargement of liver and spleen. We will also check his leg for any sign of bleeding, scratch mark, or rash. We will check his joint to rule out any sign of inflammation, and then we will finish the exam. It will take only 1 minute to say this. Okay, so now that's actually what you're going to do in here. See that if you know what you're doing, you can even finish things in 1 or 2 minutes. But obviously, you have to go in detail with the examiner. So for that part, when you need to say the steps of physical examination to the father, just very quickly give an idea that what you're going to do. Vitals, growth chart, then the rash examination, hand examination, lymph node examination, then face examination, chest examination, abdominal examination, leg examination. That's all, right? So after that, you'll say that now I'm going to discuss the examination with my examiner and come back to you. Please excuse me for a moment. After that, you will go back to the examiner. Now in online exam, you will just say, dear examiner, I'm going to discuss the physical examination of a 5-year-old boy who presented to me after having a rash on his body after taking amoxicillin for his sore throat. So then you will start your physical examination in detail, just like before. So everything that we have discussed initially to the medical student, you will just discuss that to the examiner. So that's the only thing in this case that you need to add. Obviously, you are adding some things in here. So when you will be discussing things to examiner, you will also cut it shorter. So you might need to cut it short as you are doing this case, because you will be running out of time if you're explaining things in detail. So this was the case, like most likely the rash that your child is having is called Epstein-Barr virus infection or infectious mononucleosis. It is caused by a virus which usually spreads through infected person's saliva, like kissing, sharing drinks, or having food using the same cups or utensils. Primarily in 5% cases, it can itself cause a non-itchy rash, but most of the cases, if a patient with this condition is given amoxicillin, they present with a generalized itchy red rash all over the body. That is usually what we get in a Epstein-Barr virus infection. It could be due to this. Okay, so differential diagnosis is always same: ITP, Hsp, leukemia, meningitis, drug-induced, viral, or allergic. There are other hematology cases which we'll be discussing. Now, one of them is one of the patient who you're going to do a pre-operative assessment showing low platelet count. Patient coming to you with a rash at the lower limb. That's your ITP rash that we have done. Patient comes to you with a unilateral inguinal lymph node enlargement. Same examination. Another is a pregnant woman, early weeks of gestation, comes with fatigue. Hemoglobin low, do relevant physical exam. Same physical examination. Mentally retarded patient with rash in the lower leg. That was a Hsp rash. Same physical examination. So all of these are cases which is important. Now, if you're looking for some of the differential diagnosis, DD of low platelet, we already know. So it could be ITP, viral infection, drug-induced leukemia, lymphoma, aplastic anemia. If it is an inguinal lymph node enlargement case, we need to add that we need to check the genitalia for any rash, discharge, ulcer. to rule out sexually transmitted illness. We should also look into the lower leg for any skin lesion or ulcer. That's for inguinal lymph node enlargement case. We just add this part. Apart from that, everything is same. In inguinal lymph node enlargement case, the lymph node examination should be discussed in detail, all the lymph node. And what are the differential diagnosis of lymphadenopathies? Lymphoma, genital infection like STI, any viral infection like Epstein-Barr virus, CMV, or toxoplasma, leukemia, lower limb infection, or even a skin cancer in the lower limb. In case of pregnant women, we need to add some of the other things, especially because pregnant women having a microcytic hypochromic anemia, your main two differential diagnosis is either it's an iron deficiency anemia or it's a case of thalassemia. So you have to add a little bit. So in the face, you'll be adding for any sign of hemolysis or hemolytic anemia, like malar prominence, frontal boozing, depression of nasal bridge. In the mouth, sign of iron deficiency anemia should be talked about: angular chelosis, stomatitis, atrophic glossitis, chelosis, those things you should add. CVS examination should be added in a patient with anemia in pregnancy to rule out any possible heart failure. Then abdominal exam as it is in the leg edema should be also added. So these are only things that you should add in the pregnant women case. So one of the other physical examination for rash cases that comes in exam frequently, and it is very, very confusing for most of you. I'm going to show those things to you. One is herpes stomatitis. So herpes stomatitis case, we will discuss that how to explain it to the medical student and everything. So there is a case. Then there is a case of seborrheic dermatitis or psoriasis that will also be discussed in detail with online format. There is a nappy rash examination that also will be discussed in detail. So those are the three other rash examination, which is super important for the exam. And I guess like many of you who are at the end of your preparation, you know how important those are and how confusing those are. So I have already written those examinations. We will discuss it in our classes. Okay. The next topic that we are going to start with is the wrist cut injury, one of the other important topic for the exam. Before we do that, we'll take a 10-minute break just to give your brain a little bit of break so that it can take that wrist cut injury physical exam, because it is really hard. Which case, Dr. Nigali? The thing is, the basic approach is always same. We always say the reason that why we are doing this particular exam. So reasoning is always there. So whenever you say something, you should always say why you are looking for it. And for mentally retarded patient, it usually comes in online exam. So not much to be done about it, because mentally retarded patient cannot give consent for their medical health. So the patient will not be there, their carer will be there. So you just need to make sure that the carer has the power of attorney to discuss about this patient. Or if this is the legal guardian of this patient. So you just need to make sure that you ask that. You say that, first, I would like to ensure that you are the legal guardian of this patient and you have the consent to discuss about this patient. Okay, and then you have to explain these things to that legal guardian. Yes, even if it is to the examiner, always say that why you are looking for or what you are looking for. Because examiner will then understand that what you are asking or what you are doing, you know the reason of it. You are not just memorizing a note. All right, guys, so let's take a 10-minute break and then we will do a restart injury examination. Okay, guys, so let's start again. So now we are going to do wrist cut injury. So wrist cut injury, it is important for both your online and face-to-face exam. The case is same, just the approach is different. So 30-year-old male come to you with a knife injury at the volar aspect or the flexor aspect of the left wrist. Bleeding has stopped with pressure. Your task is to teach the medical student about physical examination with anatomical landmark and give your diagnosis with reason. Most of the time, diagnosis will not be there in online exam unless it is very well written in the stem. Okay, so what is the main physical examination that you are going to do in a wrist cut injury in the flexor aspect of a hand? First, we are going to do it as a face-to-face case so that you understand the basic of it. And then we are going into the detail of how to do it on an online case. Always remember, guys, like you need to first know how to do a physical exam, and then you can always use your own language to describe it to a medical student. So don't bother too much with how I'm going to explaining these things to a medical student. No, you can. If you know this physical exam well, you can use your own language. So first know the case better. So what we will do in here, so we will start with the introduction with the medical student. We'll describe the wipe approach. We will assess the vital, arrange painkiller for the patient, and then start with the general appearance. So in the, like, let's say it's a face-to-face exam. In that case, we don't need to, like most of the time, they will say that explain or do physical examination on the patient. Let me just go through one thing. So in here, there is an online format explanation to med student. It will be from here. So we'll discuss when we go to that slide. Now, in this case, let's say we are going to do a face-to-face examination and we are doing the examination on a patient. So obviously with the patient, you will introduce yourself. So hi David, this is Dr. Ashan, one of the doctors in this clinic. I'm very sorry to know about your injury to your wrist. And I'm glad that your bleeding has been stopped. How are you feeling right now? Are you having any pain anywhere? Yes, doctor, I'm still feeling pain in my cut. Okay, I can give you some painkiller if you want. Yes, doctor, that will be nice. Okay, so do you have any allergy to any medication? No, doctor. All right, so I'm going to arrange a painkiller for you so that you feel comfortable. Then, so David, I'm going to do a physical examination on your hand because you had an injury by a knife just along your wrist joint. There is a possibility that it can cause injury to this underlying structure. So I will do a physical examination of your hand just to make sure that you haven't injured anything like that. During my examination, I will be very gentle. Is that okay with you? Yes, doctor. So you introduced yourself, you took permission. In here, there is no need of any exposure because it's already exposed. And you can say then I'm coming to you after washing my hand. David, first of all, I will make sure that your vital is stable. So dear examiner, I would like to know if my patient vital is stable. I would like to know about the blood pressure, pulse rate, respiratory rate, temperature, and saturation, please. Examiner says patient vital is stable, please proceed. All right, so David, first, I will start with having a general appearance first. So on general appearance, my patient looks comfortable, although he seems to be in pain because of the knife cut injury to his wrist. So what you are saying it to the examiner, you're giving a running commentary. Then, David, will you be able to put out your hands on this pillow so that I can have a look. Yes, doctor, that's fine. So first, on the palmar aspect, you will be looking for, so you can say that on palmar aspect, there is a longitudinal cut at the wrist joint, about 5 centimeter in size, no active bleeding, no thinner or hypothinner wasting, and I can see the normal finger posture is lost. Now remember one thing, if you put your finger like this on a table, you will find out normally your finger is always in a semi-flexed posture. And that's the normal finding. If anyhow the wrist tendon is cut out, then that normal finger semi-flexed posture will be lost. So in this case, sometimes you can find out that patient will show it to you when you are doing inspection in face-to-face. Patient will keep it as a straight. The hand will be straight like this. So then you have to comment on that normal finger posture is lost. This will be a key step that you are talking about it. And then you can say, can you please turn over your hand for me, David? On dorsal aspect, there is no swelling, no scar, no redness, rash, or deformity, no muscle wasting, no sign of trauma. So normally we always follow the SSRR BMD in inspection. So what is that? S for scar, another is for swelling, redness, rash, bony deformity, muscle wasting. After look, then you go for feel. So you'll say that, David, I'm going to feel your hand right now. Is that okay with you? Yes, doctor. So then you will use the dorsum of your hand to compare the temperature of the both hands and give running commentary to the examiner that there is no change in temperature on either hand. Then you will check the radial pulse, making sure it does not cause any pain to the patient injury. Okay, and comment that if the radial pulse is normal in rhythm. Now you don't need to say what is the pulse rate. It's not important for you. So if you can only comment that I can feel the radial pulse, it's not weak and rhythm is regular. Then you'll give a gentle pressure on the nail bed of the thumb or any of the finger, and then press it for 5 seconds and release. In a healthy person, the pallor that happens when you press over the nail, it should turn to normal color in less than 2 seconds. So you just press over the nail bed of the thumb for 5 seconds and release. When you release less than 2 seconds, the nail bed should have its normal color. And if that comes in less than 2 seconds, that means patient having a good peripheral circulation, which means that there is a very unlikely that patient has injured any of the vessels. Okay, so we check for temperature, pulse, and capillary refilling time. So see that this is the cut wound. You can also check the pulse over here. That's fine. As long as you are not pressing over the cut, that's okay. So temperature, pulse, capillary refilling time. In here, there is no need to check for any tenderness because patient will be very tender already because this is a cut area. So tenderness is not very important. So only thing on palpation that we will be doing is look, feel, sorry, only thing we will palpate in here is the temperature, pulse, and capillary refilling time. Now, it is important to do it on the cut wound, not the other hand, because why we are checking capillary refilling time and pulse? Because there is a chance that radial artery can be injured, right? But if you get a normal pulse, if you get the capillary refilling time normal, that means the vascular injury is not there. So there is a reason why we are checking it. If the patient having a normal warm periphery, it means there is adequate circulation on that arm. That means very unlikely that there is any vascular injury. So everything that you are checking, there is a reason. So after you have done the look, feel, then move. So we always start with look, feel, move, sensation, power in that way. So in the movement, there are mainly 3 movements that we do. So what are the movement? Wrist movement, finger movement, and thumb movement. Wrist has mainly 2 movements, flexion, extension. There is also radial deviation, ulnar deviation, not important for this case. So we will ask, now you will say that now I'm going to ask you to do some movement of your wrist and finger. First, we will start with your wrist joint. So you will ask the patient to do like this. So you can always show to the patient. So will you please bend your both wrist upward like this? So you will show this to the patient. So can you please bend your both wrist upwards like this? And patient will show it to you. Now, can you please bend your wrist downwards like this? Okay. So now you're doing a finger flexion and extension. That's your finger extension. That's your finger flexion. Now wrist flexion and extension. Wrist flexion is done by the flexor carpi ulnaris. Flexor carpi ulnaris is one of the very important muscle, and also it has the tendon. So that muscle causes your wrist flexion. See this one, flexor carpi ulnaris tendon. This flexor carpi ulnaris tendon helps with your wrist flexion. Now, if there is any way this tendon is cut, then the patient can have loss of wrist flexion. So check for it. Then we will check for finger flexion, extension, abduction, and adduction. So finger has 4 movements. Now, we have a whole physical examination on upper arm. So in the upper arm physical examination, we will show you how to do this movement exactly. Tonight, it's not the time to go in detail about the upper arm examination in full. So let's just discuss that what we are doing, and then in the specific physical examination classes, you will learn it in detail, that how we do the finger movement, how we do the thumb movement and everything. In the finger, we are checking for flexion extension. So let's say that how we do the finger movement.
Hello, my name is...
So normally you don't need to do in this way. So normally what you will be doing, that you ask the patient. Let's see. They haven't actually shown in here, that's fine. So the finger flexion, we will ask the patient to bend the fingers towards me. So you can say that, can you please bend your fingers towards yourself and then straight it. So bending the fingers is the flexion and straightening it is the extension. And abduction, adduction is mainly we ask the patient, can you spread your fingers? That's abduction. And can you close it in? That's adduction. Now we have some videos on this movement. When we'll be doing the upper arm examination, I will show it to you that how we do it. Okay. Now in this case, finger flexion can be lost. Why? The finger flexion is again the same thing. So finger flexion will be done by two specific tendons. One is called flexor digitorum profundus, which flexes your both proximal and distal interphalangeal joint. So proximal interphalangeal joint and distal interphalangeal joint, this whole finger flexion will be done by the flexor digitorum profundus, FDP. And the proximal interphalangeal joint flexion will be done by the flexor digitorum superficialis, FDS. So if any of this tendon is cut out, then patient will have loss of finger flexion. There will be no problem with the finger extension. So that's why we're looking for it. Abduction, adduction can be lost if there is injury to the ulnar nerve. We will come into that. Next is thumb movement. Thumb has 5 specific movements: flexion, extension, abduction, adduction, and opposition. What are those movements? Let's have a look. So that's your movement of thumb. Flexion. So in the flexion, you will ask the patient, you can always ask the patient, can you please follow my thumb movement? So you can say, can you please try to touch your thumb with your little finger? So when the patient is trying to touch the thumb, they are actually doing the flexion of the thumb. Then can you please try to bring your thumb away from the index finger? So this is the index finger. This is the thumb. So can you please try to bring your thumb away from the index finger? You can always show it to the patient. Patient will easily understand and follow your comment. Then can you please touch your thumb to the index finger? That's adduction. And can you please move your thumb towards the ceiling? When patient moves their thumb towards the ceiling, that's abduction. So flexion, extension, abduction, adduction, and opposition. Opposition, again, you can ask the patient, can you please make a ring for me? When patient making a ring, that's the time they are doing opposition. Okay, so flexion, extension, abduction, adduction, and opposition, these are the 5 thumb movement that we need to do here. Again, flexion means, can you please bring your thumb? You can always say in this way, can you please bring your thumb towards your little finger? Can you please bring your thumb away from the index finger? Can you please touch your thumb to the index finger? Can you please bring your thumb towards your ceiling? Can you please make a ring using your thumb and index finger? Okay, that's opposition. So these are the thumb movement. Now, what are the thumb movement that can have problem in here? Sorry guys, just 1 second. Something is not working. Okay, sorry for that. So do you guys understand how to do the thumb movement? Now, in this case, what can be lost? In the thumb movement, you can have loss of thumb flexion, abduction, adduction, and opposition. Only extension is done by the radial nerve, so that will not have any problem. But all other movement, flexion, adduction, abduction, opposition can be lost. Now, if you look at here, some of the nerve that I have written in here, that will also help you to understand that the wrist flexion is done by flexor carpi radialis and flexor carpi ulnaris. Finger flexion is done by flexor digitorum superficialis and flexor digitorum profundus. Profundus helps with the extension of both PIP and DIP, whereas superficial is only PIP. Both of them are supplied by the ulnar nerve. Then you have abduction and adduction, which is done by the interosseous muscle supplied by ulnar nerve. In the thumb, abduction is done by abductor pollicis brevis, adduction done by adductor pollicis, opposition done by both median and ulnar nerve. Muscle name is not important. So you can always say in that way that abduction is done by abductor pollicis brevis supplied by median nerve, adduction done by adductor pollicis brevis supplied by ulnar nerve. So if either the tendon or the nerve is injured, you can have loss of thumb abduction, adduction. So movement is important, and you have to give a little bit of time in here because your passing this case depend on how you explain the movement in here. Because this is a little tricky, as you can already understand. A lot of muscle, nerve is involved here. So try to remember this and understand it properly. So wrist flexion extension, loss of wrist flexion will be there. Finger flexion extension, abduction, adduction. There will be loss of finger flexion if there is injury to the flexor digitorum superficialis or profundus. There will be loss of abduction, adduction if there is ulnar nerve injury or interosseous muscle injury. Thumb movement, 5 thumb movement is there. 4 of them can be lost if there is ulnar nerve or median nerve injury. Only extension will be spared. Now, the very important thing is to discuss that how we know that if a patient finger flexion is lost, is it due to the tendon injury? And if it is tendon injury, which tendon has been injured? The problem is, if you come across here, you can see the flexor digitorum superficialis supply the proximal interphalangeal joint. Same flexor digitorum profundus supply the proximal interphalangeal joint. So how we know that is the FDS or FDP is injured? Because both of them can flex PIP joint. So that's the time we have to do a test. And you have to explain it properly that to differentiate between the FDP and FDS tendon injury, we have to examine it in this way. So what we will do, all right. So hold down flat all fingers but one. So we will hold down all the fingers, but just only one finger, we will not do anything. And we'll ask the patient to flex that finger at the PIP joint at a right angle. When you are restraining the other fingers, you are actually restraining the movement of the FDP. Why? Because FDP acts as a muscle action muscle, which gives 4 tendon from a single muscle. Have a look. This is your FDP muscle, flexor digitorum profundus. Then muscle becomes tendon. And as you can see, it gives 4 tendon. So if you somehow hold down all these fingers, then what will happen? The FDP will not be able to act. Now, if the patient is able to flex their finger at the PIP joint, that means it is the FDP, it is the FDS, the superficialis, which is acting. So that's how we know that it is FDS or FDP injury. I know it is not going into your head. Let's show you one thing. Okay, you can see here what is the finger flexion. This is the finger flexion, that's the finger extension. This is the abduction. See this one? So what you are doing, you are holding down all the fingers, but keeping the middle finger alone. And then you ask the patient to flex this finger at a right angle. When the patient flexing it at a right angle, they are using their proximal interphalangeal joint, right? So when you are actually restraining all other finger, you are restraining the FDP, flexor digitorum profundus. Now, if the patient is able to flex the finger at PIP joint, that means this patient's FDS joint is working. Okay, is it clear, guys? So if that is the case, that means patient does not have any injury to the FDS. So that's actually what you need to discuss. If you can't discuss it properly, it becomes very, very hard in the exam. And I will show you how to explain it also in the online format. So if we repeat again, so the thing is you need to first understand what is the job of flexor digitorum superficialis and what is the job of flexor digitorum profundus. Profundus is a mass action muscle. And you can see that this is the profundus giving a tendon, and that tendon flexes all the four fingers. And the profundus flexes your finger in both PIP and DIP joint. Whereas flexor digitorum superficialis, it's not a mass action muscle, and it's only give one tendon to one finger, and it only flexes at proximal interphalangeal joint. Now, because both superficialis and profundus flexes at PIP joint, we can't be sure that which tendon has been injured. To differentiate that, what we do, we restrain all other fingers but one. And then we ask the patient to flex that finger. If the patient is able to flex the finger, then most likely the FDS is intact. Because by restraining all other finger, you are restraining the FDP muscle. Okay. All good. So we have done look, feel, move. After look, feel, move, then there is sensation. Sensation, we only will check in the hand dermatome. So with the use of a cotton wool, we will check the sensation on the thinner eminence. Thinner eminence and index finger, it's for median nerve. Let me show it to you. So you can see here, this is the thinner eminence and this is the index finger. So you will check these two for median nerve, little finger and hypothinner eminence for ulnar nerve, and then anatomical snap box in here for radial nerve. These are the area where we will be checking the sensation to rule out any injury to any of these nerves. Most likely if radial nerve, if median and ulnar nerve is lost, then there will be loss of sensation in these areas. In flexor aspect of the wrist injury, most likely either median or ulnar nerve will be injured. Radial nerve will not be injured, most likely. So look, feel, move, sensation, and lastly, power. We check the power. Now again, in upper limb neurology, you will know how to check all of it in detail. In the power, mainly C8 and T1 we will check. For C8, we will ask the patient to squeeze my finger with your fist. And for T1, spread your finger, don't let me close it in. Again, I will show it to you how we do this. So C8, T1 will be checking. We'll be doing two other special tests. One is called pen touch test, that is positive in median nerve injury. We'll be doing a Froment sign, which will be positive in ulnar nerve injury. So for power test, we'll be mainly checking the power of the median nerve and ulnar nerve. For the pen touch test, what we do, we ask the patient to bring their thumb up to the ceiling and touch the pen with the tip of their thumb like this. If a patient is able to touch the tip of the pen using their thumb abduction is working. And thumb abduction is given by the median nerve. That means median nerve is intact. And then there is Froment sign. In Froment sign, you ask the patient to put a paper in between the thumb and index finger like this, and you will be also doing the same. And then you will try to pull out this paper out of the patient hand. If you are able to do that, that means patient's ulnar nerve is not intact. Because when patient is doing this, they're using their interosseous and lumbricals muscle, which is supplied by the ulnar nerve. And if you can see two things, one, that you can easily pull out this paper, that means ulnar nerve is weak, or sometimes patient can do a flexion of the thumb. And that also indicates that ulnar nerve is not working properly. Let me show you this video, you will understand it. So see that what we are doing, you put a paper in between the thumb and index finger, and you are also putting it in between your thumb and index finger exactly in the same position. And now you are not able to pull out the paper. That means patient having an intact ulnar nerve. Now this one means this ulnar nerve is weak. Sometimes if you see that the thumb has got flexed in the DIP joint, that also suggests that ulnar nerve is not very strong in this patient. So that's all about this wrist cut injury examination. And most of the time, whatever findings will be given by your examiner, you will be giving your diagnosis. Like if you get all the flexion of the wrist and hand is not working, then you can say that it's a severe deep knife wound injury, which causing damage to all flexor tendon of the wrist and hand. If you get ulnar nerve, median nerve function lost, then you can say also injury to the median and ulnar nerve. This is from your handbook, condition 050. Now, before you go, I'll just show you how this same thing you can explain to a medical student. So explain in this way, like, hi, John, this is Arshan, one of the GP in this clinic. It is very nice to meet you. So which year you are in currently? Fourth year, doctor. That's great. It must be exciting for you. Well, I'm very glad to show you one of my patients today. Same thing. We're using the same thing always. So we have got a 30-year-old patient presented with a wrist cut injury by a knife. Today, I'm going to discuss with you on how to examine such a patient. If you do not understand at any point, please do not hesitate to ask me. First, we need to think what could be the underlying structure that can be injured in such an injury. Given the site of the injury is at the flexor aspect of the wrist, we need to rule out any injury to the underlying nerve, vessels, tendons, and joints. Keeping these possible injuries in mind, we will start our physical examination. But before we start, we need to wash our hands, introduce ourselves with the patient, take a proper consent about the examination, and request for an adequate exposure of the examining part. Once he has given the consent, we will start with general appearance to check if he looks comfortable or in distress. If he is in pain, we will offer him painkillers, making sure he is not allergic to it. Then we will check his vitals, including all of it. After that, we will check his general appearance, whether he is comfortable or in distress. Then we will inspect the hand in both palmar and dorsal aspect. So you are starting the inspection. In palmar aspect, as you already can see in the picture, there is a longitudinal cut around the wrist about 5 centimeters in size with no active bleeding. We will also check for any thinner or hypothinner muscle wasting, which we can find in median nerve or ulnar nerve damage. And also we'll check if the normal semi-flexed finger posture is lost, which can be lost if there is an injury to the flexor tendon of the fingers. Are you with me so far, John? Do you understand what I'm talking about? So always involve the medical student every now and then. Then we will look at the dorsal aspect of the wrist, looking for this SSRR-BMD. Then we will do palpation of the hand. So you have done inspection, then palpation. On palpation, what we are looking for, first we will assess the temperature of the hand distal to the injury with the dorsum of our hand, comparing it with the normal side. Warm periphery will suggest adequate blood supply. We will also try to assess the radial pulse with the tip of our, usually 2 fingers is fine, tip of our 2 fingers, making sure patient does not feel pain as the injury site is very close to the radial artery. Sorry, it will be does not does feel. So see that we have written in here, like we will try to assess the radial pulse with the tip of our 2 fingers, making sure patient does not feel pain as the injury site is very close to the radial artery. Then to assess the capillary refilling time, we will apply a gentle pressure to one of the nail bed for about 5 seconds and then release. In healthy person, it should return to normal color in less than 2 seconds. This way, we can rule out any possible vascular injury. Okay, so in palpation, we'll check for temperature, we'll check for pulse, which is very important because that will assess that if the patient having any vascular injury, and we'll check the capillary refilling time. After that, we will check the movement. First, we will assess any injury to the wrist flexors by checking the function of the flexor carpi ulnaris and flexor carpi radialis. We will ask the patient to bend the wrist upward and downward to assess wrist extension and flexion respectively. So wrist flexion, extension is done. After that, we will check the finger movement. Finger has 4 movements: flexion, extension, abduction, and adduction. Show it to the medical student with your hand. Flexor digitorum superficialis helps with flexion of the finger at the proximal interphalangeal joint, and flexor digitorum profundus helps with movement of the finger at both PIP and DIP joint. That's why it can be quite confusing if finger flexion is impaired at PIP joint, as it can suggest injury to the both tendons. See that now it's not very difficult. We are explaining in very clear, simple way. To differentiate To differentiate between these two, we will hold down flat all the fingers but one. Then we will ask the patient to flex the remaining finger at the PIP joint at a right angle. So we'll ask the patient to flex the remaining finger at the PIP joint at a right angle. When we are restraining the other finger, we are actually restraining the movement of the FDP because it acts as a mass action muscle. So now we have also explained how to differentiate between FDS and FDP tendon injury. Then we will assess the thumb movement by asking the patient to do flexion, extension, abduction, adduction, and opposition of the thumb. Abductor pollicis brevis tendon injury can impair the thumb abduction, whereas adductor pollicis injury can impair thumb adduction. So we are explaining things with anatomical landmark. We are also explaining with appropriate muscle and tendon name. Do not include the nerve in the movement because then it can become quite confusing. Keep the muscle and tendon for the movement. In sensation, we will discuss about the nerve. Then we will check for sensation to rule out any nerve injury. To assess the sensation, we will use a cotton wool and a red hat pin. First, we will touch the sternum with the cotton wool so that the patient is aware of the sensation. Then we will touch the cotton wool on the thenar eminence and thumb for median nerve, hypothenar and little finger for ulnar nerve, anatomical snap box for radial nerve. Then we assess the power of the specific nerve. For median nerve, we will do pen touch test. So you'll just explain how we do that. For ulnar nerve, we do the Froment sign. We will place a piece of paper in between the thumb and index while we will try to pull it out. If patient cannot hold on to this, weakness of the ulnar nerve. This will finish our examination. We will summarize our finding, discuss the management and outcome of the injury with the patient. We will thank him and finish with wash our hands. So that's how we explain things to a medical student or to an examiner in online exam. The reason why I have written it in every possible detail is because you need to understand how you should do it. Now that you know, you can use any of the any physical examination that you do, you can now explain things properly. Okay, online exam is not that hard if you can understand how you need to explain. And Dr. Geetha, if a piece of glass is there in the cut, then we will not remove that glass. It's very important because we don't know which structure it is injuring. If we remove the glass, patient can have like severe injury. So the glass will be there and we will examine the patient with the glass inside too. You can mention about tetanus immunization for both glass or knife injury if the patient tetanus immunization is overdue. Look that we always look for something which is not very, very important. Like in here, they will look for your physical examination. It's not actually managing this patient. It's about physical exam. If we give more time and more attention to a management in the physical exam, it doesn't matter. You can always say about how you're going to manage this patient, tetanus, IV fluid, all of this is a management. It's not so important part of a physical examination. Does physical examination need tetanus immunization? No. So I know that from where this coming and everything, but it's important to focus on what is the task. Task is important. If it is a management, then yes, tetanus immunization, making sure patient is in an operation theater sometimes to manage this injury, everything is important. We will do it. But our task is physical exam. We just do the physical examination in here. As long as we are doing it, we can pass it. That's your number 81 page. All right, guys. So that brings us finishing of our tonight's session. I know it was very hard for you, given this is the first physical examination class. And this, trust me, this is one of the hardest physical exam, this wrist cut examination. But that will be fine, don't worry. I hope that you guys understood the both online and face-to-face format. And now if you understand it, it becomes easier for me also to discuss things in a quicker way for our rest of the physical examination. Dr. Riham, we just did it, right? We just did the explanation of online thing. So you already have seen that how we will be doing it in online exam. We talk in the movement, we are talking about muscle and tendon. In the sensation, we are talking about nerve. That's fine. You don't need to go in much further. It will confuse you and everyone. Now, you don't know, Dr. Wafi, if radial artery has been cut or not. To assess that, you are checking the pulse, right? So you can't assume always that a knife cut injury will always cut the radial artery. You are doing this physical examination to know that. So yes, if you can, you will check the radial pulse to assess the radial artery. If you can assess it, it means radial artery has not been cut. I guess that when we explained it to the medical student, we also explained in a very simple way that it can be also used to a patient. And this case will never ever come to explain to a patient because they know that this is not possible for a patient to understand. And medical term, Dr. Anam, is that always you have to use medical term. You use flexion, you say, what is flexion? It's the bending of the finger, right? So if you are doing a flexion of the finger, then it is bending of the fingers towards you and straightening it. That's extension. So you use medical term, but you explain it. All right, any question, guys? So that's all about the physical examination class 1. So I guess that all of you has already got our physical examination class schedule. So, and for the course students, obviously, this was a free class, but from the next one, it will be just a part of the course classes. If any of you who are not a part of the course still want to join the physical examination, just feel free to send us an email or either inbox us, and then you can join from the next class. All good. So we'll finish it here tonight. Have a good night, guys. Bye. Thank you all.